We have a warning from the Coronavirus Task Force tonight. The risk of COVID for all Americans is at a historic high.
But it's not just that. Health leaders worry the virus could kill upward of 200,000 people by February as hospitals reach capacity.
As we sit here today, 90% of our hospitals in this nation are actually in what we call one of the hot zones.
Since November 1st, the total number of hospitalized COVID patients in the U.S. has doubled. It's closing in on 100,000. And as 41 Action News reporter Ariel Rothfield shows us, local hospitals are worried about more than one shortage.
When the day started Wednesday, Truman Medical Center had patients in 40 of its 41 ICU beds, with more patients awaiting bed placement in its emergency room.
We were pretty busy and we're pretty full here at the hospital.
But it's not a shortage of beds which concern doctors here. It's a shortage in staffing.
There's a limited workforce out there that has the necessary training. And I know there's been occasional discussions about setting up field hospitals and those kind of things. But quite frankly, I think within our hospitals, we have places to put patients. I mean, that's not unlimited, but up to a certain point, we're going to need staff.
To address the shortage, Missouri is partnering with a Texas-based company, Visinet, to deploy healthcare workers to stressed hospitals.
The plan will allow for up to 760 additional staff across the state, including registered nurses, respiratory therapists, certified nurse assistants. When fully deployed, this will add nearly 600 total beds to our statewide bed capacity, including some critical care beds.
The state will pay for part of this partnership through CARES Act funding. The rest will be covered by the participating hospitals. Right now, it's unclear what hospitals will be eligible to receive the help and how much the program will cost.
Whatever the cost is, this is about saving people's lives. This is about taking care of Missourians.
At Truman, the care is continuing. The hospital has contingency plans in place for beds and staffing in the event they see a surge in cases. But to really help, doctors say the answer is simple.
We would like to see a blunting of the curve and a reduction in the number of new cases. If we can reduce the number of new cases, we'll reduce the number of hospitalizations.
Reporting in Kansas City, Ariel Rothfield, 41 Action News.
Liberty Hospital told us that they, like most hospitals, have staffing concerns given the trajectory of cases. They say any additional staffing would be welcomed, particularly as they get deeper into the holidays and cold and flu season.